Now, good morning and welcome to Health Matters, your daily dose for health updates and stories that matter. Now, today we focus on to a pressing public issue affecting Narok County, Trachoma. Trachoma is a preventable eye disease that, if left untreated, can lead into eye blindness. Now, despite the global efforts to eradicate it, Narok County remains one of the most affected regions in Kenya. To shed light into this story, we have a special report by our correspondent, accompanied by interviews with the health experts and the local community. Let's take a look at this story.
Trachoma, caused by bacterium chlamydia trachomitis, is spread through contact with eye discharge from infected individuals, often facilitated by flies, poor hygiene, and unprotected sex with infected persons. In Narok County, the disease thrives due to limited access to clean water, poor sanitation, and overcrowded living conditions. The World Health Organization has classified trachoma as neglected tropical disease, and Narok County is one of the areas targeted for elimination by 2025. But how close are we to achieving this goal? Let's hear from Denish Onyango, a health practitioner in Narok County.
So thank you, Dr. Onyango, for welcoming me and my team. Can you please tell us the situation of trachoma in Narok County?
Okay, the current situation in trachoma itself, trachoma, first of all, trachoma is a bacterial infection that normally deals with the eyes. Yeah, so the current situation in trachoma in Narok County, as far the range according to the nearest days, it's not that too much. I can say that it is minimal, since the prevention, they have make a very good prevention on it.
And what are these measures that they are taking to combat trachoma?
Okay, as we all know that trachoma, it's being caused through I can say that it is a contagious disease. It is a contagious infection that can be transferred through fluids or touching uncontaminated places. So the preventions that have been made is that most of people, we have been practicing unprotected sex, and also we have been practicing a proper sanitation of all surfaces areas that someone might be contaminated with.
Okay, so like Narok, you know, trachoma is an arid disease and Narok is an arid area. So like what measures can you tell or what can you tell to the Ministry of Health in Narok County about the trachoma situation?
Okay, the trachoma situation, according to the Ministry of Health, they have tried to bring some of the preventive measures that we can come up with so that we can avoid the spread of trachoma. First of all, I would like to tell the Ministry of Narok County, first they should adhere to the rules and regulations that have been put up place so that each and every person can able to follow. Second, I would like to say that let's bring sanitizers so that we can prevent most of the infected areas, since it is a contagious disease. Let's say someone is affected with trachoma, then another person will touch the surface. So let's maintain more surface sanitizers so that we can be able to maintain and clean all of the surfaces. Secondly, I would like to ask the Ministry of Health in Narok County that they can bring more condoms for the youth. Since trachoma is being spread through saliva and vaginal fluids, so that we cannot be able to have unprotected sex.
Despite these efforts, many communities in Narok remain unaware of the disease and its prevention. Let's hear from a local resident, Mama Naserian, who has experienced the impact of trachoma first. Mama Naserian's story highlights the urgent need for awareness and resources in Narok County.
Mama Naserian, thank you for speaking. Can you just share your experience living with this trachoma?
Okay, thank you. When this disease trachoma has affected me. First, it started when I lost my sight. Okay. Yeah, and I went to the hospital so that it can be confirmed. And then the doctor told me that it was trachoma. Yeah.
What are some of the signs that you experienced so that you went to the doctor?
I started losing my sight, and right now I can't see clearly. things that are far away, I can't see very well. Even you, I can see you, like you are somehow blue.
Okay.
Yeah.
What do you think should be done so that this can help? So that
Okay, thank you for that good question. You see, this health expertise should take things like missions to also to our place, because I can say I'm not the only one who is suffering from trachoma in our community, but there are some people. Yeah, so if they can teach us on how we can know how we can actually the effect, yeah, and how we can combat such kind of diseases. Yeah, so we just need education on this.
okay, have you done your surgery?
No, right now, I don't have anything, and that surgery actually requires a lot of money, and I can't afford it. So kindly, well wishers, wherever you are, you can help me so that I can treat this deadly disease.
The fight against trachoma requires not only medical intervention but also community engagement and infrastructure development. Remember, early treatment and good hygiene practices can save it. If you or someone you know is experiencing symptoms like eye redness, irritation, or discharge, seek medical attention immediately. Remember, together we can stop and prevent trachoma.
Now, thank you for that insightful report. That's all for today's edition on Health Matters. I'm Fabian Ocheng, and you've been watching Peak Media.